Understanding sexual health at 70. Sexual health is a vital part of overall well-being, regardless of age. Many assume that sexual activity dwindles with age, but that's not always the case. In fact, many 70-year-old men continue to have active and fulfilling sex lives. Factors influencing sexual activity. 1. Physical health. General health significantly impacts sexual function. Conditions like diabetes, heart disease, and arthritis can affect sexual performance. Regular checkups and managing chronic conditions are essential for maintaining sexual health. 2. Psychological well-being. Mental health is crucial too. Depression, anxiety, and stress can affect libido and sexual performance. Keeping a positive mindset and seeking help when needed is important. 3. Relationship status. Those in loving, supportive relationships often report higher levels of sexual satisfaction. Communication with your partner about desires and expectations is key. 4. Medications. Some medications can affect sexual function. If you're experiencing issues, discuss with your healthcare provider to see if your medication could be a factor. What's normal? There is no one-size-fits-all answer to how much sex is normal at any age. The frequency of sexual activity varies widely among older adults. Some 70-year-old men might have sex several times a week, while others engage less frequently. What's important is that you and your partner are satisfied with your sex life. Benefits of sexual activity. Improved cardiovascular health. Sexual activity can be a moderate form of exercise, helping to maintain a healthy heart. Better sleep. Physical exertion and the release of endorphins can lead to better sleep. Enhanced mood. Sexual activity can boost your mood and reduce stress. Increased intimacy. Maintaining a sexual connection can strengthen your relationship and emotional bond. Tips for maintaining sexual health. 1. Stay active. Regular exercise can enhance libido and improve overall health. 2. Eat well. A balanced diet supports overall well-being and sexual health. 3. Communicate. Open communication with your partner about your needs and concerns is essential. 4. Seek help. Don't hesitate to talk to a healthcare provider about any sexual health issues. In conclusion, sexual activity in your 70s can be just as fulfilling as at any other age, though it might look different. What's most important is that you and your partner are happy and satisfied with your sex life. Remember, there is no normal frequency. What matters is what feels right for you. If you found this video helpful, please give it a thumbs up, share it with your friends, and leave a comment below with your thoughts or questions.